We do a lot of nursing home cases. We find that there's a wide gamut of things that can and do occur in nursing homes that unfortunately are not always beneficial to patients in nursing homes. Very often you're talking obviously about older people, and at times you're talking about people with some form of dementia or other limitation where they're not in a position to look out for their own best interests. And in that circumstance, the patient is looking for the people in the nursing home to look out for his or her own best interest. When that doesn't occur, that causes a lot of unfairness and problems for people, to say the least. When you have a nursing home that is understaffed, that can be highly dangerous to the people, the patients who've been left in the care of that nursing home. It's called a nursing home for a reason. You should have adequate nursing staff. Unfortunately, some of these larger national nursing home chains or corporations tend to look to maximize their profitability by minimizing, to the extent they possibly can, within a regulatory framework, the amount of nurses and other staff that are caring for sick, elderly, potentially demented people. And that is something that can lead to all kinds of problems. We've had cases where people are not properly supported, who are considered to be and whose treatment plan of treatment says that they're a high fall risk. They may need to be supported by 2 support staff at any time that they're moving or going to the bathroom. And you often find that there's not enough staff to do that. There's only one person who's assisting, and the person falls. In that type of circumstance, you're talking about crushed shoulders, crushed hips, and other types of injuries that are going to significantly impact the ability of that patient and that client to continue to live his or her lifestyle as that patient used to, because they're going to be in almost constant pain, and will unfortunately find that they may be a deterioration in that person's ability to cope with daily activities after that, and that's very unfortunate. We see other type of more abusive behaviors also in nursing homes, and those need to be addressed. And we're happy to be able to help families address that kind of thing, where people are taken advantage of because they're not in a position to complain perhaps about abuse. People at times who've suffered mental deterioration can be a little more aggressive than your average person, but it's up to the staff, the nursing staff dealing with that person, to do so in a caring and understanding fashion rather than abuse that patient. So we won't stand for that kind of thing. We even see patients who at times are not able to communicate at all on a long-term basis, or to move, who may have suffered physical or sexual molestation or injury of one kind or another. They're not in a position to fend for themselves or to report what has happened. And when that occurs, we are very happy to be able to help that person and his or her family to seek compensation for what has occurred, and to stop it happening in the future.